Good evening, ladies and gentlemen. Welcome. It's such a pleasure to be here today. I'm Pablo Mugüerza, and this is my clinic. This is a medical translation clinic for all students of translation in general. All of you specialized in medical translation. All of you interested in medical translation, and anyone who is everybody is welcome if you want to join us because this is free. This is live. I am right now. Valladolid, which is a town in Madrid, Spain, 200 kilometers north from Madrid, and it is 4 p.m. here. It's Central European time, and I hope you enjoyed this presentation. I wanted to first of all, I would like to describe my screen. What you can see before, you see that we're broadcasting live. That says en vivo in Spanish. Also, you see that we're in chapter 4. This is the fourth day we are broadcasting this clinic. We do it every second Tuesday of the month. Today is the third because we had during the last week I was very busy doing other things and I couldn't attend this. But although today is the third Tuesday of the month, we usually do this in English the second Tuesday of each month. We repeat this webinar tomorrow in English. That means every third Wednesday. The second Wednesday of every week. So next month you will have it, that will be June, and we will have it this presentation in English, the second Tuesday of June, and the very same presentation in Spanish, the second Wednesday of June. I think I've said that wrong. It's difficult for me to keep the track. But also you see that I am Pablo Mugüerza, as I told you. And also this miracle of technology you're seeing right now live and free on all networks, of almost all networks, is enabled by TranslaStars.com. This company which is organizing all the time training for translators of all kinds. Please visit their website. They are really great. They are doing a great job. They are really revolutionizing the market of medical translation in general, because they take care of all the realms of translation, legal translation, audiovisual translation. They are on many other sites. Please take a look to TranslaStars website and know all they are doing, boot camps, other streaming like this one. But on other topics, you can see that they have on streaming. I don't know exactly the dates, but about SEO. They also have on streaming about financial questions with an expert, one of the best experts in Spanish in the world, probably. So also free, also on all nets. So please take that opportunity. I would have loved to have it when I needed it. So, and even now, when I can attend. So also see that our sponsor is here in the middle of the screen, just Point, or Just Point if you pronounce it in English, and it's a company of software for translators. Also very, very extremely interesting. Please visit their website. Not only TranslaStars, also Point, please, and they help us a little bit because, of course, this is although we offer it free, there's a lot of people working to get this here. Also, you can read there, follow us on social media and TranslaStars.com. I am a physician, I am a translator, and if you have questions, which are the key for this clinic, it should be based on the questions. But I don't know why. When I do it in English, maybe you don't understand me, I don't know. But when I do it in English, we do interact very, very little with me. I don't get many questions. I would like to have a comment, feedback, questions. you can enter the chat and ask me, and if I can, I will try to answer. If you don't make questions, as it has happened in the last 3 chapters, no problem. I've prepared my pills. We have Dr. Mugüerza's pill clinic. We have a pill in every session. Today is the 4th, as I told you, and we have been talking about several issues that I find interesting to bring here and to say a few words about how to translate them, mostly into Spanish. Forgive me because I am very ignorant, and I only can speak this English and an average Spanish, which is my mother tongue. So always when I translate into Spanish, and I will talk about translation. The first language, target language for me is Spanish. I have some command for the languages, but I'm not entitled to talk about that professionally, right? Just as an entrepreneur. So I will not. Now let me share my screen so that you can see today's pill. As I told you, it should be here we are. Thank you. And you say we have a medical translation pill every second Tuesday of the month. Next on June the 7th. That's the second Tuesday of June. And you're very welcome, of course. Tell your friends. There's something I want to tell you. If you like this presentation, you probably guess that we are making a big effort of all kinds, personally, professionally, economically, of all kinds, to have this live every month. Please, if you like it, if you want to help us, just let the world know. Right? Say that in your network. Say, I was there and I enjoyed it. Dr. Pablo Mugüerza is useful. If you don't like it, it's not necessary. You don't need to say, he doesn't know a word. It's not interesting, and and the screen is terrible. You don't need to tell. People doesn't need to know that. Today, I've prepared a pill which I particularly like, because it is the translation of these 2 terms: decentralized clinical trial and virtual clinical trial. The information you're going to receive right now, I will deliver for you later. Most of it was produced before the pandemics. And before the pandemic, the world was getting ready for decentralized clinical trials and virtual clinical trials, because it was clear that it was the future. Basically, I've spilled some water, I'm sorry. Doctors, physicians, investigators were realizing that this issue of having, very long clinical trial, 2 years of clinical trial, 4 years of a clinical trial, and having patients going to the hospital and getting back home for every week, every 2 weeks, twice a month. It depends. That is uncomfortable and not very useful, maybe. And today we have the tools, the software tools and the hardware tools, enough to do this remotely. So why not to try? So imagine, I will not repeat this, but imagine that all the information I will show to you today was written before the pandemics. So the pandemics has enhanced and intensified all you will hear today. So I'm talking about decentralized clinical trials, and I will talk about point of care and a few terms more. And this is information written before the pandemics. Imagine how all this has changed, and how you may understand how it has evolved after the pandemics. So the first approach to decentralized clinical trial, pay attention to always to decentralized with an S or decentralized with a Z. Right? Usually it's English from England. When you say decentralized with an S and with a decentralized with a Z, it's usually American. The United States, which I prefer to America. There's a lot of countries in America. And as you can see all the time on the screen, if you have questions, in 5 minutes I will be answering them. So no problem to translate. The first approach is that it's very easy. This is one of the things I love most about talking about medical translation, is that I love this apparently so easy translations. The centralized clinical trial has no mystery initially. If always, if you're not a professional, you would say, ensayo clínico descentralizado in Spanish. Very easy to translate in all languages. Trial is a word you know, clinical is a word you know, although maybe you don't know that clinical comes from the Greek klinos, and klinos was that piece of furniture where people was lying while eating, right? So klinos in Greek, clinical comes from there. And Greeks and Romans used to eat lying, with the grapes hanging, and that's where the word clinical come from. And decentralized mean not centralized, right? So I don't know what is the first idea which comes to your head when you hear this decentralized term, but in Spain, for instance, it's different. In Spain, we have, as you know, probably, I don't know if you know that, we have the capital of Spain is in Madrid, and the country is divided into 17 what we call autonomous communities. And they are autonomous, and they are in some ways independent. They are responsible. Each of these 17 autonomous communities, they are in charge of health, for instance, education, capital issues, very very important problems. Imagine what happened when the pandemic came, when our friend, our enemy, the SARS-CoV-2 arrived in our lives. The 17 small autonomous communities, small compared to the rest of the world, had to face the problem of getting masks, getting vaccines. They needed a national coordination among the 17 communities. So we say we are a decentralized country. And that's the first idea you get. Now it's something geographical, political. Decentralized means the things doesn't happen in the capital of the country. They are distributed more or less evenly among the parts of the country. The states is the 50 states of in America, and then Germany is the Länder, and all the countries have this. But look, what is interesting. Let me also tell you that most of the information you will read today, as I told you, written before the pandemic, comes from a website, a very one of the most useful tools for the medical translation. It's called Cosnautas. I will not write it. You have heard about me about it. It's in the chat in case you can access to it. I'm writing it. Cosnautas.com, and it's although it's in Spanish, it's a collection of dictionaries and tools for medical translators into German, particularly into Spanish, but also into German, and now from Portuguese. Since last Saturday, they inaugurated the Portuguese version, and it's absolutely necessary. It's not free. You have to pay. It's very, very, very affordable. Really can pay for that. It's not a lot of money, and I strongly recommend. Most of the information you will see today is taken from there. So if you like it, try to visit Cosnautas as well. So no problem to translate the centralized clinical trial. Later we will talk about virtual clinical trial, and you don't have a problem to translate that. But look at the synonyms. You can find also the centralized clinical trial. Remember, we've talked about this in another chapter, that most authors use the terms study and trial as strict synonyms, as strict synonyms, and they are not. This is a common issue in medical translation in general. There is a theoretical difference between two terms. We are obliged to know as a professional. We have to know which is the difference between trial and study. But what we see in the practice when we go to work and translate as medical translators, what we find is that most authors, most documents, most texts you translate are using these terms as strict synonyms. So it's exactly the same saying decentralized for most authors. It's exactly the same saying decentralized clinical trial and decentralized clinical study. Also, you have the centralized trial, the centralized study, of course, direct to participant study. This is also an ensayo clínico descentralizado, centralized clinical trial. Direct-to-patient clinical trial. Remote. I have to admit that I haven't seen the other synonyms in my practice. Remote clinical trial, yes, I have. Remote, another word for decentralized in this context. Remote study, remote trial, and siteless study. Well, this I've never seen in my experience. But well, I was looking at this book I mentioned. This is the dictionary. This, sorry, it's not a book. It's an electronic dictionary. And siteless trial, cosnautas. Remember. Mm, so you have here this definition, a more strict definition about the centralized clinical trial. Please listen to my words. Well, I won't read in this text, but please listen to it or read it carefully, because here is the key. Decentralized in medical translation, particularly in this my specialization, which is clinical trial documentation. In this particular context, decentralized has another meaning. You know, the first thing which came to my mind when talking about decentralized, what I told you about this political geographical division in my country and in yours probably. But decentralized means in this context, when researchers conduct, we talk about decentralized and clinical trial, when researchers conduct a clinical trial by enrolling, consenting, monitoring, and collecting data from patients in their homes using digital tools and their devices. Researchers may also deploy ambulatory care teams and may direct participants to regional or central labs for infusions and labs instead of requiring participants to visit a traditional centralized research facility. Sorry, I have to insist on this. This was written before the pandemics. Before the pandemics, there were a lot of investigators considering the possibility of stopping this habit of bringing patients all the time to the clinic, to the hospital, and having them waiting there and send them back home. And because, of course, if you're talking about a clinical trial about, let's say, hypertension, well, you know, people with hypertension may be otherwise healthy, and well, it's not a problem for them to go every week, let's say, or every 2 weeks to the hospital to have their blood pressure measured and determined, and maybe take a drug or receive an injection wherever. That wasn't the problem. But think of, there are many studies, clinical studies, whose participants are really have severe diseases, like cancer, like degenerative diseases, the neurological degenerative diseases, autoimmune diseases. We have problems to move, to go to the hospital, to drive a car, to stay hours waiting. We have that. The problem is that, and with the pandemic, this problem has increased a lot. It was a problem. So it's great that before the pandemics, investigators were thinking about stopping this and preventing people to be all they coming every week, every 2 weeks to the hospital. So this is the definition of decentralized clinical trial. And here you have the other one, virtual clinical trial. Also, the first thing is ensayo clínico virtual. Very easy to translate, no problem. I would like you to pay attention and try to understand the heart of this. Now you have synonyms: virtual clinical study, virtual trial, and that abbreviation. Other possibilities are the estudio clínico virtual, ensayo virtual. The context. Virtual clinical trials are a subset of the centralized clinical trials. So all virtual clinical trials are decentralized, but not all decentralized clinical trials are virtual. This is important. So there is a difference. You may think them as synonyms, and they are not, right? Maybe they are the same, but maybe you have a study where they are using it as synonyms, but them as synonyms, but they are not. Virtual clinical trials are a subset of decentralized clinical trials that are fully virtually enabled with digital tool and devices, require non-face-to-face patient-to-researcher (PI) in primary investigator interaction. Medical devices, e-clinical solutions, and video visits are commonly deployed to facilitate this VCTS, right? So in these cases, patients have no need to come to the study center to share that with Decentralized. It is a type of decentralized clinical trial. So remember that there is this theoretical difference between decentralized and virtual in this context, right? They are not strict synonyms except when they are. So because the virtual clinical trial are a subset of decentralized clinical trials. Let me see if you have any questions right now. No, it seems not. Um, um, so, and the opposite to decentralized clinical trial, and as you see, I'm focusing on this term. We will see in the next slide which something very interesting. We are focusing on this. The opposite to centralized clinical trial is an estudio clínico centralizado, which well, the synonyms that you can think of, the descentralizado. Um, well, forget about this because that's wrong. Centralizado. We are talking about centralizado. Sorry, forget about the other possibilities here. And in the context, a centralized clinical trial is when researchers conduct a clinical trial by collecting data from patients in a centralized location, what we call a site, a medical clinical site. And that's a definition by now in 2020, before the pandemics. In these cases, the patient must come to the center or on scheduled visits for data collection. This is the classical way of performing clinical trials. And I would like you to pay attention to the difference. Up to now, it seems very easy, although probably you've realized that the centralized and virtual are not exactly the same. But let's go a bit beyond, and you have decentralized testing. Now that we understand what is the decentralized clinical trial, let's pay attention what is a decentralized testing. It's also called point of care testing. This is important. This, in my experience, this is what you will find in your medical text most commonly. Point of care testing, POC testing, alternate site testing, ancillary testing, bedside testing, decentralized testing. Well, as you see, patient-focused testing. There are many possibilities found by the author of this dictionary I was talking about to you about cosnautas. But the author of this, Fernando Navarro, which is, as you know, the main authority in medical translation from English into Spanish, and he is the heart of Cosnautas, he proposes this very good the translations. You see that it's the centralized testing, and he suggests as translations analysis de diagnóstico inmediato, immediate diagnosis analysis. You know that first of all, you have to know that in Spanish we use a lot the word analysis for tests when you're talking about probably particularly when taking blood samples. We are talking in Spanish, we say, with an analysis and manage analysis. Usually this analysis also encompasses in Spanish simple tests like an EKG or maybe a breathing test or and spirometry, the easy tests which require small devices and not a lot of machinery. So immediate diagnosis analysis, immediate analytic diagnosis, and also bedside analysis. Point of care may sound very well to you in English, and you understand exactly what it means, but if you translate it into Spanish, and I guess that the problem is the same when translating to other languages, when in Spain we don't have something like a punto de atención, punto de asistencia. Patients will not recognize that. They will understand perfectly this immediate diagnosis analysis, bedside analysis. Bedside is the most the translation which sticks more to the original, and from my point of view, to this point of care. So decentralized testing means not taking the blood. I mean, if we reduce everything to that, not withdrawing the blood at the hospital, at the investigation site. No, you do it at the bedside of the patient, or in a place close to where they live. Do you understand what I mean? is taking blood samples as close to the patient homes as possible. Again, let me repeat that this is not this was written before the pandemics. So understand that today and in the future, the centralized clinical trials and the centralized testing will be the common, the golden standard for taking blood tests from the patients. So please remember that we have mentioned decentralized clinical trials, meaning that they are the big group, right, which encompasses the virtual clinical trials. DCT, by the way, you may find DCT. I'm sorry. You know that the problem with the abbreviations we have in all languages, and DCT may mean several different things. Usually, the context will guide you to the right solution, to the right deploying of the abbreviation, but you have to be careful with that. DCT in this context is the centralized clinical trial, and VCT is a virtual clinical trial, and then you have POC. If you are on the net, you're probably like me, watching Instagram, scrolling Instagram when you're waiting for the train, or I'm traveling on Thursday, and while you wait for the train, or you're waiting for the cab, or wherever, you scroll through down Instagram, and maybe you use the reels. I don't know, but I find them useful when I'm bored. I don't have any other thing to do. I can read a book or listen to music, and you have all the time their POV, point of view. And so we're in this world of abbreviations. Our ability to write is limited all the time. Twitter is limited. Usually, when you're filling a field in a form, they will say, I don't know, 500 characters, and you have to be very careful and always calculating. And if you do subtitles, you know what I mean. So we're in the world of abbreviations, and it's good that you learn these new ones: DCD, VCD, and POC. Like from point of care. Remember, when translated into Spanish, it depends on the country. Probably Mexico, or maybe in the United States. Those people who speak Spanish in the United States may be already saying punto de atención for point of care, but Cosnautas and myself strongly recommend to use análisis de diagnóstico inmediato and diagnóstico análisis de cabecera. I love análisis de cabecera. Al pie de la cama del enfermo, al lado de la cama del enfermo. That's very good if it helps to you. Some authors, I will read this because I don't know it by heart. Some authors clearly distinguish between the concepts of point-of-care testing, which I've talked to you before, point-of-care testing, which they reserve for immediate testing performed with small handheld analyzers or devices. So on one side, point-of-care testing, another possibility is near patient testing, and they use NPT, this abbreviation, on near POC testing, which they reserve for immediate testing performed with the small benchtop analyzers. So they use POC for handheld analyzers. They used NPT for benchtop analysis. And there's a third concept, alternate site testing, which they reserve for immediate testing performed with laboratory analysis, but outside the clinical analysis laboratory. They are laboratory in the investigational side, in the clinical side, the head, the center where things happen, right? But there were patients used to go every twice a week or I don't know, every 15 days. And I would like to finish this spiel today in order to answer your question if you have any. I don't know. I hope so. With a few abbreviations you will find in this context. First of all, you have ADAM, which is Analysis Data Model. I will not go deeper in this. The ADM sets provide a connection between SDTM, we will see later, and data sets, and final statistical analysis. I only want you to know, es el modelo de datos analíticos, or I would say translate that, but even In English, of course, you will find ADAM. I haven't found agreed translation of this abbreviation into Spanish. So I strongly recommend to use the English one because it's the only one you find when you Google this, and most people is using Google for um, learning about these issues. Then, in this very same context, you will say, I don't know why. Well, as soon as you Google or you look at, if you go into Google Scholar, or if you go to more specialized databases or navigators, you will find BLA everywhere. And BLA is a biologics license application. A biologic license application is a request to introduce or deliver for introduction of a biological product into interstate commerce. Just American. It's only in the States, right? But we are dependent of American medicine and American investigation, so we have to be ready to find this BLA and not to translate it. And, you can give some advice to the reader and say, well, this is a solicitud de autorización de productos biológicos, for instance, but good, that's a possibility I am thinking about now. But the important is that you will find this in this context of the centralized clinical trials, virtual clinical trials. You have DCT that we know that it's a decentralized clinical trial, and together with BLA, you will find NDA. They always come together in this context, BLA and NDA. You know what an NDA is when you get a new client, you're so happy, how new client, there's new opportunities. Maybe I will forget this project manager I hate so much. Sorry, I love project managers. Hello, project managers. I hope there is some of you here. You do a great job. I'm just joking. But you know what an NDA? It's a non-disclosure agreement, and you sign that when you get a new client, meaning that you commit yourself to not releasing the information, to not making public the information that you get from the client. Usually, it's confidential, it's private information, and it will be a crime if you spread that information. So you sign an NDA with your contract or with your first assignment with the companies. The other abbreviation I wanted to bring here today is POC, point of care. In this context, be careful. In other contexts, it may be a different thing. And also the SDTM. Remember at the beginning I say ADAM means is the ADAM sets. Data sets provide a connection between the SDTM data sets and final statistical analysis. Here you have SDTM. It's a study data tabulation model, and the SDTM data sets provide the standards for organizing clinical trial data following database lock. You know that there is a point when the study ends, and there's the end of study visit has taken place for the last patient, and there is a moment there, a point in the time when they lock the database and they say no more data are allowed to come in, and we are now going to work with this closed database, which is not admitting new data in, and that is called SDTM. Also, you have VCT, which is virtual clinical trial. And if you're interested about any of the issues I've dealt with today, you have my sources. My sources were, as I told you, first of all, Cosnautas, and then you have the third place, the opinion of the FDA about all this, which is probably interesting for you to read. Take a capture of this slide, so that you can look at it later if you want to. And I think that is all for today. Yes, I'm ready now for your questions, if you have any. Let me see. Otherwise, Sarah Pacheco. Sometimes, thank you, Sarah. You're so kind. Sometimes glossaries have the abbreviations already translated into Spanish. Yes, I know that problem. Thank you, Sarah, for pointing this out. Monica Caldeiro, thank you. Analysis ambulatorio. That's a very good question too. Sorry, let's go first with Sarah. Sarah asked, what happened when the glossaries bring the translated abbreviations? Well, that depends on you. I'm sorry, I cannot say a strict rule for you to apply to say I will always do this with abbreviations, always do that. No, it's a particular problem you have to solve when you face it, and you have to. You take a look to the glossary, Sarah. You take a look to the glossary, see what they have there, and now you have to understand which are the needs of the reader of the text you are translating. Probably patients need all the help, and probably you know that they I don't know, you know something about their cultural level. I don't know. You have to decide what the reader needs and act consequently. And so if you understand that doing it translated into Spanish is useful for your reader, maybe you can use them. But I wouldn't recommend that. Even if you, particularly in this so modern things, these things we were changing before the pandemics have changed during the pandemics and will change after the pandemics if we ever leave the pandemic behind. Please, we are fed up with pandemics, aren't we? It's a decision, Sarah, which is very difficult and that you have to take every time. It would be uncareful for my part, and unprofessional maybe, to say always do this, always do that. My opinion is that as medicine evolves, it's more and more useful every time to use the English abbreviations, because when you look for information, when you want to get more information, it's in English and in the net and the networks, wherever you look for that. Particularly those I've mentioned today, the table, remember, the centralized virtual point of care, particularly these are very so recent that you will not really you will not get a good one or an agreed one, or of course I wish we had an authorities agreed at the definition, but we don't have an authority. We don't have an we have the EMA, of course, in Europe, but they don't take up decisions about this kind of decisions. Also, we have a question by Monica. I like it, analysis ambulatorio. I like it, but I think that ambulatorio means in our country, in Spanish, probably has a bit. I don't know if bedside means exactly ambulatorio. Of course, I think that ambulatorio refers to the patient who can walk or not. Who can walk to the. Thank you to you, Sarah. Who can walk to the, close to the residences, to where they live, home. I think they can walk there, not drive or take a train I think that's the definition of ambulatory. So if you're taking the devices and these handheld devices or these benchtop devices, we're taking them to the bedside. I wouldn't say they are ambulatorios. So now I'm thinking as I read, and that's not very advisable in my case, at least I have to think slowly, but I'm thinking probably some of these decentralized clinical trials will be ambulatorios. I think they have the ambulatory term in English as well, and it is and it will be okay. But I think that some of this is decentralized will be ambulatory, and then it will be a brilliant solution, as usually like from Monica Caldeiro. But I don't think it's good for all the decentralized clinical trials. So that's what I think. Diego Tomasello, I think there is a problem. Diego Tomasello, sorry, I was watching your question, but it has disappeared. Lion Kadra, hello, doctor. Hello, hope you are doing great. Which is a dimerization switch? How do you want me to know? I see here. It's the internalization mechanism of a cell penetration peptide. Well, I've just Googled it, and I have a very good document by the National Library of Medicine saying that it's a how a peptide enters the cell. And you know, a peptide is made of pieces, which are called dimers. Switch means a deviation or a change. I would say that dimerization change may mean something like desviación. Let me look at how is dimerize. So we have the word dimerize in this dictionary. And I discover now, thank you, that there is the word, if you're looking for a translation into Spanish, I don't know, your name doesn't look very Spanish. And in Spanish, we have dimerizar. The verb dimerizar, so it's very easy to translate. It's una desviación para dimerizar. And dimerizar is to make dímeros. It's a bit specific, your question, and that's all I can do now. So a dimerization switch is something they do, a process they use to get peptides, which are usually a kind of drug, peptides to cross the cell membrane and enter the cell. So I can't say anything else. Let me see. Of course, it's a mechanism for uptaking peptides by the target mammalian cells, suggesting a role of higher order structure in modulating the action of this novel cell penetrating peptide. So you're asking to me about something I have never heard. That's very good. Tests me and challenges me, and I hope I have helped you. But you know, my specialization is clinical trial documentation, and your question was probably a bit specific for me. I'm sorry if I haven't been helpful. So, is there any question else? Not really. So, I can feel. I have filled the blank by talking about another issue completely different to what we've mentioned right now. If I can share again my screen, thank you. Just in case, you know, I had this prepared just in case there were no more questions. So just in case, we have this translation of baseline, and basal. I have found in my experience, I've been translating for 36 years. I am a physician, and I found along my career many common problems which have solved along the years. When we 35 years ago, we had some problems with very common problems, which have people have learned, and probably due to the work of many of our the people who has preceded us, and these problems have solved. But this particular problem, the translation of baseline and basal, hasn't been solved, and this is still a problem for many translators, mainly because most translators consider that they know the right translation for these terms, and I do not agree. I am the only one who's not disagree with these terms. So you make the decision. I will show you my reasons, what makes me translate baseline and basal and the way I will say now. And I will please listen to my reasons and decide on your own. What do you prefer? But when you go to the dictionaries in Cosnautas, and in most dictionaries, you will find the primary definition, the primary translation is initial. In Spanish, inicial. My point is the following. At the beginning of a clinical trial, there are many things happen. You have to enroll the subject. The subject has to sign consent form, informed consent form on ICF. Have to sign them, and probably at the beginning there will be some tests. They will probably take their blood pressure, they sign the vital things, measure the height, the weight, many things happen at the beginning of the clinical trial. In my opinion, all those things are initial, and they are not baseline exactly. One of those, imagine the easiest clinical trial you can think of, a drug, a new drug, let's say a new drug, which is able to reduce blood pressure, right? And so the patient will go every week to I don't know, to the hospital, at their home. And by the way, let me say that today we had a very interesting study, a meta-analysis. You know what a meta-analysis is? When they get many studies of on the same issue and they study them together and get data from the set of all these studies as a meta-analysis. If you know what I'm talking about. So today we have the results of a meta-analysis about the usefulness of measuring blood pressure at home, particularly in pregnant women and in pregnant and women with chronic renal problems. And it seems that measuring the blood pressure at home did not improve the results, did not help at all at the general conduct of the trial. It just was exactly the same. It was supposed to be better, and in 50% of the cases, it didn't mean anything, just exactly the same. In the rest, it was worse. It was worse that people measured their blood pressure at home that they did at the hospital, if they had it measured at the hospital, the site, at the clinical site. So, going back, imagine again the easiest clinical trial we can think of about a new drug which is able to reduce blood pressure. And so you request the patient to come every 2 weeks or every week to have the blood pressure measured and to take a pill, maybe, or to take it at home, right? Well, at the beginning of the clinical trial, probably you will measure the blood pressure several times, maybe the day one or the day -3 or day zero, several times in order to to start a clinical trial. And only one of these measurements is considered baseline. Only one. You will write down, blood pressure this day, blood pressure this day, and that visit, and then they would say baseline blood pressure, and that one will be the one with which you will compare all the measurements you will do in the following weeks, months, and years of the clinical trial. So you will compare when you're in week 37 and you measure the blood pressure of the patient. You will not compare with any initial blood pressure measurement, but with a particular one, the one you tagged as baseline. So all baseline measurements are initial, but not initial measurements are baseline. That's my point. That's why I would like to highlight for you today. Baseline, by the way, is a noun, and basal is the adjective. In Spanish, it's the same. It's basal. Basal. And I would recommend that, although only, except if you have a clear definition, it may happen that your clinical trial, the protocol you're translating, the document you're translating, has a clear difference between baseline and initial. But in that case, they will just initial in English. Why don't they call all these procedures initial in English? They call them baseline. They have initial. They could have used that. You have said the initial baseline blood pressure was whatever, and they don't say that. They use baseline blood pressure. So that's my point. Keep, if you agree with me, keep the difference always. If you find the term initial in English translated by initial, but if you find that you will very often find baseline measurement, baseline procedure, baseline wherever, use basal in Spanish. That's my recommendation. And that's all for today. If you have unless you have more questions, I will see you again. Well, if you want to listen to me in Spanish, which is my, I express myself better in Spanish than in English, but probably you've been able to follow me. We'll meet again next Tuesday, June the 7th. That will be almost summer. A wonderful time of the year for me here in this town. Is wonderful. Is great. Thank you to you, Monica, as usually. Please, if you would like to contact me, it's very easy. You can visit my website. There is at the top right, there is a section where you can text me and send me messages if you want to. You can also follow me on Twitter. I am Tadumelik there, and it's really, Twitter is becoming really fascinating for medical translators. I strongly recommend you to have a professional account on Twitter and follow the main authors or professionals you're interested in, and it's a great way to remain updated about the profession. It's everything's there, and if you want to, you can also join my Facebook wall, Traducción Médica Aplicada. Although it's most of what I write there is in Spanish, most of what I post there is in English. So even if you don't understand what I write personally, it doesn't matter. You will find very interesting information, posts of articles of all the magazines, Science, Nature, Lancet. I take care of all that, and I bring to the Traducción Médica Aplicada all the articles which are interesting about science, languages, medicine, and so on. So I wish you a very happy rest of the day. Thanks for attending, and bye-bye for now.